Okay, so we're here for another episode of Mason's Medicinals for the Real Mushrooms Practitioners podcast. And today we're going to talk to Dr. Colleen Smith. And Dr. Colleen Smith is a doctor of veterinary medicine, and she's an integrative and conventional practitioner. And she's got a focus in small animals, but also a focus in horses. And Colleen has experience using acupuncture, herbs, diet therapy, and chiropractic with animals. She has also just recently been appointed the president of the AHVMA, which is the American Holistic Veterinarian Medical Association. So welcome, Colleen.
Hey, it's great to be here. Thank you.
Yeah, it's great to have you here. Yeah, this is going to be great. I know a lot of people are looking forward to learning more about your practice, your background, and yeah, just everything to do with pets, wellness, and medicinal mushrooms. So thank you again for taking the time to be here with Real Mushrooms.
Sure.
So
I'm glad to be here.
yeah, us too. So based on my little intro, is there anything that I missed in terms of your sort of academic, professional background that you'd like to share with the listeners?
I always wanted to be a vet since I was a little kid, and it took me a long time to get here. So I totally appreciate people that take the roundabout way to get where they want to go. But I absolutely love it. I'm super passionate about it. I feel blessed that I get to do holistic medicine, especially because I get to practice how I want to practice. And I've really come to understand that that's how all medicine should be practiced, just because it's so individually based. And you're just really looking at the whole body. And I think allopathic medicine has a little bit of backlog on looking at the body as a whole. It's all connected. And so that's kind of how I look at my patients and my own health. So I practice what I preach. So I take mushrooms myself, mushroom medicine, lots of different herbal medicine. Yeah, I'm a very active person. I love being outdoors. I mountain bike, kayak, whitewater kayak. I'm a third degree black belt. I love to stand up paddleboard, and I have two dogs that I take hiking. Well, my older dog is 16, so she doesn't hike as much, but she's still doing pretty good. So I've been in Chattanooga for about 10 years now, or about 15 years now. My practice about 10 years now. So and I love it. It's a great outdoor town. It's my kind of place. So and I practice with two other veterinarians, and I have a nice staff. They're all trained in herbal medicine, and they're there for the holistic aspect for it. So it's been really cool to be able to practice the whole thing. So yeah.
Awesome. Yeah, sounds like a great team and a great cohesive unit with shared values and philosophy. When you
Yeah.
talk about individualization and kind of looking at health from that more whole body, whole patient perspective, how does that show up in animals? I'm curious, and in your patients, because as I work with a lot of humans, and I might view that as like looking at their physical body, whether that's like their structure or seeing if all their organs are
Mhm.
going, or looking at their mental sort of status with like beliefs or just kind of thoughts going through, and then also like emotions and maybe spirit if some people are into that. So how does that show up for you when you look at your animal patients?
Oh yeah, I look at all of those things. I'll kind of start with one of the basic things that I do though, especially I'm in the Southeast, so it's very not as a holistic mindset as like maybe California. But the big thing that I start with is nutrition, because I think in human medicine and animal medicine we just don't have the knowledge to discuss that with our patients. We just don't learn that in our education, and it's a huge influence on health. And you only work as well as the chemicals you put in your body. So if you're putting highly processed foods in your body, and anything I do supplement wise, surgery, vaccines, whatever, everything's got to work harder to make a healthy body if you're starting off with a processed chemical as your nutrition support. So the first thing I really do is I discuss nutrition. And there's so many people that come in with their pets and the dog's got skin issues, and they're like, why are you talking about diet? And I'm like, because diet has everything to do with the skin. Or they have GI problems. It has everything to do with the GI issues. Cancer. Oh my gosh. So that's always usually my appointments are well over an hour, which very frustrates my staff. and my practice manager. They're like, get out of the room. But that's a big thing that I talk about is nutrition. And if I can't change the nutrition, or if they can't, for whatever reason, then I do have to increase the amount of medications I use. And it affects the livelihood and the longevity and the health of the animal. That is a big thing. It is socialization is huge. I talk about that with young, middle-aged, and older dogs. I mean, it's just because you have a big fenced-in backyard doesn't mean they're using it. You do need to work their mind, just like us. Walking them around a neighborhood is better than just throwing them out the backyard to go to the bathroom for 2 minutes.
Yeah.
Socialization with other dogs, that kind of thing. It's that emotional health is very important. It is with us. I mean, imagine we just learned this with COVID. Sitting in the house all day long drives us crazy, and people wonder why their dog tears their house up when they get home and it's been in the house for 10 hours. So that's really important. I do use supplements and herbals and things when I have skin conditions. I will still use conventional medicine, but I use that secondary. But everything is done individual. 2 patients with kidney issues will be treated probably completely different, 2 different ways. So that does matter. And households and stuff, we talk about cancers, and there's neighborhoods where, if all the kids keep getting lymphoma, there's probably something going on, or leukemia, there's something going on in that area. And I do see that in households with pets. They are our canary in the coal mine. As I'm getting younger and younger dogs with cancer. 3-year-old golden retriever last week with liver cancer. I'm like, why is a 3-year-old dog getting liver cancer? There's something going on. So yeah, I look at everything from the mental well-being to the nutrition status to the socialization of the animal. Yeah, and everything, and just put it all together.
Yeah.
I hope that kind of answered your question.
Definitely. Yeah. Thank you. What are some, just to follow up with your first point there, what are some, maybe just like a very short summary? I know it's probably hard, but look, when you're looking at nutrition and people and their pets, what are some just like basic things that you like to tell everyone or work with on that more foundational diet level in terms of like food, type of food, other raw food diets, things like that? What do you like to incorporate?
I mean, people they'll say, what's the best diet for my dog or cat? I won't talk about horse nutrition, but I mean, we're feeding, they're both carnivores. I mean, and we do say, there's some people that will say a dog is an omnivore, but we force them to eat an omnivore diet, but they're not really omnivores, they're carnivores. If you look at anatomy, I go anatomy 101, let's just talk about who we're feeding. The diet is so important. GI health and all this kind of stuff. It's hard to start with what you've been feeding for your dog for the past 12 years is wrong. But so I start with what we're feeding, this highly processed food. We know they've done research that when you high heat process carbohydrates, it creates something called the Maillard reaction, which creates advanced glycation end products. Those are cancer causing agents. When you heat up pet kibble, cat or dog food to 450 degrees for 4 hours, is full of advanced glycation end products. So we're literally feeding these pets this kibble that's full of cancer-causing agents. So I kind of start there. I'm like, I don't say you're feeding your pet wrong, you're doing this wrong. I'm like, this is what this food is, and then we kind of start from there. If due to budget or time constraint, we just have to find the best store-bought something, that's fine. I give my clients homemade recipes that are balanced. And I do have people who are like, yeah, I've been giving my dog chicken and rice. And I'm like, that is not balanced. So I won't let them even change to a home prepared diet unless it's a balanced diet. And I make sure that I go over everything with them and how to do it properly. But I do say even high moisture content diet is better than a dry food because, their diets are 70 to 80% water. They're eating that rodent, deer, whatever, rabbit in the woods, it's 80% water. So eating this dry food is too dry as well. And it's full of carbohydrates. These carbohydrates are pro-inflammatory. When I have liver disease, cancer disease, or heart disease, if you're putting a food twice a day, every day that's pro-inflammatory, we're fighting this losing battle with trying to get inflammation back down. So I try to kind of go over, let's look at the anatomy, let's look what we're feeding, let's look at what's in this food and why this is really not great for your pet. This is really not supporting the health of your pet. That usually helps me. That usually gets my point across instead of saying, you're wrong. Yeah, that's the biggest part for me. No matter what they come in for, that's usually part of initial dialogue is, starting with that. And there's some dogs can tolerate raw food. I don't do raw food with older dogs. I don't do raw food with super young dogs, puppies, or metabolically diseased dogs. If they have some severe, illnesses, diseases, raw food is really hard for them to process. So in the system, it's, the transition is usually really hard. And that's the other thing too. I do have to give people a lot of information on how to transition properly as well. A lot of times they'll try to transition in one meal and they have GI upset and they think something's wrong with the food, and it's not the food, it's the system is not used to something completely different. So my ideal diet, I tell people, is a home prepared diet, but we do the spectrum, depending on the person's lifestyle. If you got 4 kids and 4 dogs, you're not going to be making a lot of food for your dogs. I have people who have long shifts, 16-hour work shifts. That's just going to be really hard for them to do a lot of home preparing and stuff. So it's just dependent on I tell the owner, if they can't do it, your pet's not going to get it. So it has to kind of go with, how well the owner, how far they want to go, their ability to do it. So, and the ability for the animal to eat it. So
that's great. That's a really good chunk of info right there. When you say balanced with the diet, what do you mean? Do you mean like flavors? Do you mean like textures, like you said, with the moisture and the content there? Or what do you mean by balanced?
No, nutritionally balanced, like the right amount of all your vitamins and minerals, your calcium, your phosphorus. That ratio is very important. Making sure you have your microminerals, your zinc, your seleniums, your vitamin E, omega-3 fatty acids. That's super important to have that all in there. Some people, I have the purist, and they'll use a lot of organs. They'll put kidney and heart and spleen, that kind of stuff in there. Some people are like, "Ooh, can't do it." So we'll have there'll be a supplement that I'll recommend that will balance out the vitamin mineral content, and then we can figure out the protein needs and the fat needs to go with it. And there can be some texture issues for some dogs, and sometimes I'll have people do it in a crock pot or make a meatloaf or, and freeze it. Some dogs are fine with the raw. Some dogs just look at the raw and go, mm. So, and they have to, partially cook it. I have my 16-and-a-half-year-old cattle dog. I partially cook her homemade diet just because she just can't process it that well anymore. But my 12-year-old dog can take the raw fine. So.
And you said it there, but what are some of, like, what are the top imbalances or deficiencies that most your patients have coming in? What are the top 3, say?
I say the calcium phosphorus ratio is really important. That's your meat to bone. Your meat has your phosphorus in it. Your bone has a calcium in it. Getting that ratio, it's around a 1-to-1 ratio, getting that right on the diet. Getting in the microminerals in there too. Zinc has a huge effect on the skin. Vitamin E and selenium work better together. So getting all that kind of stuff together. Omega-3 fatty acids is really, really important. There's research now with omega-3 fatty acids and neonatal health. So puppies getting higher omega-3 fatty acids. Puppies, they have better, learning and retention and focus. So those are kind of like, try to get the main stuff in there and then just kind of look at the diet as a whole. There's a lot of stuff on the websites that are great, and then there's some that are not so great. So I just kind of go over, it doesn't have to be my recipes, but if someone finds something that's good, then I just tell them to go forward with it.
Great. So thinking about some more central things towards, I guess, diseases, pathologies, what are the most common things you're seeing these days? Like, I know you said it might be geographically dependent, depending on what's going on, but what are some common processes that you're seeing happen in the body of your patients?
So me in particular, the primary appointments that I see are holistic appointments. So I do a lot of actually second opinion stuff. So if a dog gets diagnosed with cancer and the owners just cannot afford to go through chemotherapy, or they just don't want to put their animal through chemotherapy, I get a lot of second opinion cancer patients. So, and we want to do like an alternative track. I get a lot of chronic disease and a lot of geriatrics. So a dog with skin issues that have been going on for 4 or 5 years, and they're basically every couple of months it's steroids, antibiotics, steroids, antibiotics, steroids, and antibiotics, and the skin just doesn't get better. Same thing with, chronic GI stuff. I get these older dogs, these people are like, oh, my dog's had diarrhea for 5 years. I'm like, why is that okay? And again, they're just on medications and it's just not fixing it. So it's usually, for me, I see a lot of geriatrics, which gets a little sad for my staff, and I do see a lot of chronic illnesses, with arthritis too, but it's usually, skin, GI, arthritis, cancer. It's remarkable. Dogs and cats don't read the book. They don't get their head in the way. And then when we kind of change the base of stuff, which is the diet, and get some supplements, get them off some of those medications, we get an amazing amount of turnaround in these cases, especially the chronic cases.
Yeah, just really riveting, and the ups and downs of emotions, just working with these different geriatric dogs and pets and not just dogs. Okay, so what are some of the top strategies you use, aside from, looking at their lifestyle, like you said, getting the social behavior going, getting the nutrition kind of up to speed? What are some top things you use in your practice to sort of help some of these conditions you just mentioned, Colleen?
We kind of have a protocol just to make it easy for everybody, although it's not set in stone. Like, we have a cancer protocol with there's different treatments that we do. We use ozone therapy, and there's some other things, but we have some baseline supplements, and one of them being mushrooms. We use 5 defenders in our cancer protocol. And so everybody goes home with that. There's also a DMG resveratrol mix we use and some other immune supportive supplements, and that on top of, we try to minimize the chemicals also that are in them. If it's a really old dog who's not really going outside and not really exposed to a lot of fleas and ticks, we'll take them off their flea and tick medication. For vaccines, we will definitely do titers for vaccines so we can take all that chemical insult out of their system they've been having every year. We also use mushrooms, the 5 defender mushrooms, for all of our surgery cases. Everything, they all go home with 5 defenders to help the immune system. Basically, chronic disease is inflammation. Everything is, inflammation is the precursor to all your diseases. So most of the stuff we do is anti-inflammatory. I use Eastern medicine and Western medicine as far as herbals as well. So depending if it's, if I have a kidney patient, that kidney patient will go on with several kidney herbs, definitely changing to a high moisture content diet because you need, higher hydration in the system. We try not to send them home with a tackle box full of stuff. It's just not, and it's hard. I mean, it does get really hard to, especially with cats, pilling cats and medicating cats. It's not fun for anybody, if an animal or people, to have to take 10 pills twice a day. So we try to minimize it. Things that are very palatable and they're easily mixable in food, so we can treat them. Because if they won't eat it, then our treatment not going to work.
May I ask you what dose you use for the 5 defenders, just generally? It doesn't have to be exact, but just a consideration for those listening.
Yeah, with the capsules, I start with like 1 capsule twice a day for a large size dog.
Yep.
50 pounds plus or minus, and smaller dogs, I'll do a capsule once a day, and they can split it if they want to split it. Bigger dogs, I'll use 2 capsules twice a day. Real big dogs. I have, for some reason, a large conglomerate of Great Danes and Newfoundlands. They usually go home with bottles and bottles of supplements. Big guys, yeah. We have a lot of slobber on our walls. My poor staff has to clean it off every day.
Okay, that's a fun job. Let's just talk about the kidney herbs. What do you use for, Eastern, Western herbs to support kidney health in pets? I'm just curious personally.
There's one main herb that I use that it's been remarkable, which even when I talk to conventional veterinarians, I'm like, if you ever use a herb if you just are inclined, it's called Romania 8. It's so supportive to the circulation and function of the kidneys. I literally will have these animals come in with high kidney values, BUN and creatinine, and a month in, that value is going down. A couple months in, sometimes we can actually normalize those levels. And there's just nothing comparable to that in allopathic medicine and conventional medicine. Romania 8 is amazing. In pro-inflammation, those kidneys are unhappy and they're inflamed. So yeah, that's the first thing I try as far as trying to keep it simple for some people, because I do get a lot of people who are like, what? When they come in, they don't even know what acupuncture is. So sometimes it's easy to be like, here, just start with this one thing. And I will. Mushrooms, the mushrooms that we use primarily, they're so anti-inflammatory and immune supportive. They're across the board. I use those for a lot of my cases. They just have this general overall effect on so many organ systems that I'll use that as well. Diet is huge importance too for kidneys, because hydration is really important. So being on a dry food is not ideal for poor kidney function. That's the main one I use. There are some other renal support herbs that I'll use that are actually glandulars that have kidney in them. I love to treat the organ like with with like treating like. So my dog, she has a murmur and I feed her actual heart muscle, feed her some cow heart. And if someone can get a hold of kidneys, I'm like, feed your dog kidneys, which people find odd, but we eat, chicken. That protein turns into human muscle meat. We use that muscle, that protein, those amino acids. So they'll use this kidneys for supporting their own kidneys.
Yeah, yeah, that's great. I'm glad that that's used in the veterinarian world too, because yeah, we use some protomorphogens in the clinic here, so that's interesting that it goes across the domain there. Okay, great. So you said you got a black belt. You like the white water. You got a stand-up paddleboard. You are outside all the time, and I'm sure that your work is physically and mentally demanding. So what do you do for your own routine just to kind of keep your system revving at all sort of efficiency?
I do take supplements myself. I eat pretty well. I eat a minimal protein diet. I meditate regularly and do yoga regularly. Actually, that helps a lot. The meditation really does help a lot, especially on those sad days when you have those patients, that really close patient. Yeah, I mean, I try to eat really healthy. I try to practice what I preach, and I haven't had fast food in 20 years or a soda. My diet, I try to keep my diet really healthy, and then just mentally, I try to keep my brain. I try to support that with my staff. I've in my clinic, I've built a large kitchen with big windows and all the kitchen appliances to encourage them to cook there or bring their lunches there and not go to like the local fast food restaurant. So I just try to keep it all the way around healthy for me, mind and body, and my staff, which is, I think it really helps the well-being of the whole vibration of the clinic.
Yeah, definitely. Yeah, that whole community kind of aspect too seems to work well for folks. That's great. I'm glad you got some windows in your lunchroom.
Yeah.
That's always a plus. So you got you said you got two dogs yourself, right? One older
Mm-hmm.
dog and one, how old's your other dog?
Well, he's still older too. He's 12.
He's 12.
But yeah, I have a 16 and a half cattle dog and a 12-year-old lab mix. It's kind of sad. I used to do, 5-mile hikes with them every other day. And now my younger dog, 12-year-old, he can do like 2 miles and he's losing his hearing. And it's usually him yelling, hey, come back. But yeah, it's great. They fill my heart and they fill my home. So it's wonderful. They're very mellow. So I'm not sure if I can handle a puppy if I ever have to get a puppy, because they're just so quiet. They just sleep all day. And they get to go to work with me too all the time. So they're just so used to everything.
Lucky dog.
Yeah.
Lucky owner. Okay, great. So you said that you kind of knew you wanted to be a vet, like for a long time. Was there like a moment in your life? Did you have pets as a kid? Were you around horses or animals as a kid? Like, how did that all come about, Colleen?
Well, yeah, as a kid, I was the horse fanatic. I have probably a stack of drawing books with just horses, unicorns, Pegasus, every horse you can think of, two-dimensional, terrible 12-year-old drawings. And I would muck out stalls because I couldn't afford riding lessons. So I'd muck stalls for hours so I can take an hour riding lesson. Yeah, I think my mother expected me to grow out of it, but I was that kid who had aquarium with hermit crabs in it and salamanders and a fish tank. I would come home every once in a while with a little snake, and I think my mother was just barely grinning and bearing it, thinking for sure that I would. And I spent so much time outside. There was a little pond down the street, and I was always around the pond. And I saved some ducks and put them in the pond, and apparently snapping turtle ate the baby ducks, and I was crying for 3 days. So I always wanted to be a vet since I was a kid. It took me a little bit longer. I graduated from undergrad and worked as an environmental chemist for many years. And it took me 10 more years out of undergrad to go back to school for vet school. I've always been a hands-on kind of a person, and then also kind of problem solving and loving animals. And I'm like, veterinarian, that will work great together. So yeah, I mean, it's my dream job. I feel like the luckiest person on the planet that I get to do what I love to do. I would love to work more with horses, but my schedule is so busy. And yeah, I just think energetically, they're just amazing critters.
So you do some part-time work with horses though, when you can, is that right?
Just alternative. So I just do acupuncture on them. And the last several horses that I've worked on have all had cancer. So I would do acupuncture and ozone therapy, and knock on wood, they're all still alive and still doing well. And none of them had a good prognosis. And one of them is actually still show riding, which is amazing. My practice doesn't have a facility for horses, but I have an alley. And so I just work on them in a trailer and for an hour and then they drive on out.
That's a good model in today's ages, especially. So with the ozone, are you doing like intrarectal injections? How are you doing the ozone?
I do all the sorts. Ears, we have ear cups for dogs with ear issues. We have a water bubbler, so we'll bubble water through, so we flush wounds. Animals that have fungal infections in their nose, we'll do nose flushes. We do a rectal ozone treatment with a fecal biome transfer. So we'll do a rectal ozone, and 20 minutes later, we use, it sounds a little bit gross, but it's amazing how it turns around the GI. Then we have several dogs in the building that we've done DNA testing on their fecal samples, and they have really good, high quality bacteria, healthy bacteria. And so we kind of make a slurry out of that and literally give the dog an enema with that slurry. And we have protocols with that. I also do autohemotherapy. So we pull blood from a dog, mix it with the ozone, run it through UVB light, and then inject it right back into the dog. And it's amazing because ozone, there's no side effects with ozone. They just feel great. So we use it for so much stuff. If someone in my staff gets sick, I'm like, drink some ozone water.
Yeah, I've been hearing more and more about ozone, and yeah, I've had it done a few times. That's really great that you're utilizing it so much, and the animals are getting such a good benefit from it. With the ozone, I guess with the bacteria, do you know which bacteria were showing up as like beneficial ones for the canine species or the animals that you're referring to? Do you remember the name? Do you remember the species type?
Gosh, off the top of my head, I should have a thing in front of me. There are definitely, there's 4 bacteria, and it's hard to remember, like Lautia, I think, and some other ones, because I had never heard of them before. Everybody thinks about, Lactobacillus acidophilus, and that's not really on the list. Prevotella and some other, there's some other ones I can't think of. They'll probably trickle into my head that they have found. I guess they've done a huge study with a large population of dogs to find out what the healthy genome is. So yeah, it's been interesting because most of the patients that I test, their bacteria is not healthy. And I know mushrooms do help with as a prebiotic, and it's really important.
What do you usually test? How do you usually test an animal's microbiome? Is it just like a similar stool test to humans, or how do you do it?
There's a company that does the testing, and we just send them a very small sample, and it takes them a couple of weeks, and then they give us the report back, and then we kind of figure out, depending on what's high and what's low, of how we're going to treat it. Do we need to add more prebiotics? Do we not? Yeah, the company's called Animal Biome, and they're great. They're phenomenal. And they also make some capsules with their own freeze-dried stool of the healthy stool that we can use for whatever reason the ozone fecal transplant is not a viable issue or viable opportunity or whatever option.
Great. This is also fascinating. So you have background in environmental chemistry. So I'm curious, as we progress into the more synthetic world, maybe that's a better word for it. What are some simple things that you like to tell your patients and their owners about kind of just trying to create the most cleanest, I don't really like that word, but the most environmentally friendly atmosphere for your patients?
I do look at even the chemicals we put on them and in them as far as heartworm preventative and flea and tick stuff. And I try to keep that as clean as possible. So if I have an animal whose exposure is pretty low, then we'll try to go to more natural stuff. Some cedar oils or wintergreen collars or whatever, that's something more natural. But if I have, since I'm in the woods here, we'll have clients that are hardcore hikers and their exposure to ticks is really high. Then we just kind of figure out, but the dog is a big swimmer, so they can't do topicals. So we just or the family has a lot of kids, so they don't want to do a collar. So we just kind of have to try to kind of figure that out. But also just knowing, just vacuuming your house gets 80% of the flea eggs up and fleas. So that's pretty simple. And I, will recommend, diatomaceous earth. You can put that in the carpeting, on bedding, and let it sit, and then, vacuum that back up. There's so much other stuff out there about EMFs and things like that. And like, if you're being affected by a cell tower, your pet's probably being affected by a cell tower. And, just even the energy in your own home, if things aren't grounded properly, if it's affecting you, it's affecting your pet. Even cleaners. So, I do encourage people to clean, just use vinegar and water with essential oil in it rather than those harsh bleaches and all that kind of stuff, especially on the floors, because your pet's walking on your floor and then they lick their paws. So they're ingesting the substances. So we kind of look at everything, yard stuff. I can go on for hours about this, but one of my big issues is glyphosate, which is in weed killer. And I think that stuff is absolutely horrible. It's bad for the gut. I mean, there's a bunch of studies on how it just creates these open gaps in the gut. And this is where a lot of these allergies, food allergies, are coming from. Precancerous issues in the colon. It's in so much food. Organic is, becoming a little more controversial, how organic is organic anymore with so much stuff coming down in rain and so much runoff. But I think glyphosate is one of the worst things that has happened to this planet. I can talk about that forever, but that's that too, because most pet foods aren't organic. So they're getting really super high exposure to poor quality, carbohydrates, starches, sources in their food. So I think there's a lot more GI stuff going on because of glyphosate, allergies, that kind of thing.
Yeah.
Cancer.
Yeah, I think we could probably do a whole nother podcast on that alone.
Some lectures on glyphosate, and by the time I'm done, everybody's like, oh, what?
Yeah, what do you think is like the most embodied kind of step moving forward there without kind of falling into that kind of apathetic attitude and then the kind of, oh, whatever, we're all kind of going to hell anyway or whatever? What do you think is the best way to kind of approach that big issue?
It's overwhelming just thinking about how much the world is affected. But I mean, basically, you just got to start with yourself. I mean, the one step is what you take will affect everything else. I mean, it's without getting too out there. I mean, your vibrational energy, your energy about it is going to affect the people around you, and it's going to affect the people around them. So to me, is like, if you're just conscious about what you're putting in your mouth or what you're around energetically, how much social media are you on, that's really bad. I think mental and emotional. Yeah, it just starts with you. If your family, your kids, your pets, if you start with trying to keep that very simple and clean, that's a great place to start. And the kids, they learn not by what you say, but by watching you. So if you're eating healthy, they're going to see what you're doing.
Yeah.
When I eat healthy, my staff sees what I'm doing. And so it goes forward.
Yeah, a big ripple effect.
Otherwise, it's just overwhelming. You just kind of shut down.
So you said in the Southeast where you are, it's like, there's a different consciousness level or a different awareness level. What's it like being there? What's it like to kind of be a thought leader in your field and in your area, geographically and professionally?
I love this area. I mean, I love the Southeast. I love being warm and I like humidity. The bugs, you still find people that are like-minded, which is really good. And I do like to teach. So, and I'm used to a lot of pushback. But it's really fascinating that when I talk about my clients' pets' health and they do make some changes for their pets and they do see the improvement, then usually after a couple of appointments, they start going, what about me? And which is great. Just like, so I not only made a difference in this pet's health, but now the owner is asking me where they can go. And I kind of have a list of human practitioners that I send to, acupuncturists, even therapists, that kind of thing, that are around me, and it's just remarkable. But it is there's a lot of I think there's a lot of set in stone old school of thought type thing of like yearly vaccines, which really isn't necessary, but it's just to kind of get them in the door, and just kind of like some kind of basic treatments. When I work with dachshunds that are paralyzed, it's an old school just to put them in a kennel for a week and give them a ton of steroids. I'm like, we don't need to do that anymore. It's a little bit frustrating because usually that's what's been going on for a whole week, and then I get to see them and they're still dragging their back end. And then I'm kind of having to start kind of from scratch, but they've already been debilitated for a week or two or more. At this point in my career too, I still get comments, where's your crystal ball, Colleen? And I just laugh it off. It's funny, but there's some truth to that. It's you at first they laugh at you and then, they ignore you and then they're kind of like, well, maybe she's doing something right. So it's been interesting. In my area in Chattanooga, actually, there's a good population of some like-minded thinkers that are into kind of more alternative and holistic medicine.
It's always fascinating to hear how people are bridging that gap and staying true with what and what you've seen be successful, and what is just grounded in that like very holistic centered way of knowing. So keep up the good work. I know it's easy, but you've been doing it for a while now, so you're ahead of the curve, I think. Anything else you want to chat about, Colleen, just in terms of like general pet wellness, general health tactics? I'm just curious if there's anything we didn't cover that you'd like to speak about.
I always go back to nutrition, but I think at this point too, with as much exposure as we all get to so much stuff in life, from electricities to chemicals, that some people are like, what supplements should my pet, well, what, no, they usually say, what vitamins should my animal be on? And I'm like, if your dog is, or cat's on a, or you're on a, you eat a very well, healthy, balanced diet, you don't need that. But at this point, there's so many things, stress, especially with humans, and it does pass to the patients. So many times we're still curbside, but so many times a client would come in holding the leash, the dog is straining on the leash, the owner is rigid, the dog is rigid, and I just say, just drop the leash, and then the dog relaxes. So that stress, we're in a constant state of stress, especially in the US, and our pets are feeling it. So as far as like immune support, I think is hugely important. Even if it's a young dog eating a really well-balanced diet, we still do need some immune support because they're still getting, they go, swim in the lake. How many boats have been in that lake? So how much contamination from gasoline or whatever's in that water? We just have constant exposures. So it always comes back down to your foundation. I tell people it's like your old house, and if the wall keeps cracking and all you do is paint it, it's going to keep cracking. But until you fix the foundation of the house, then the wall stops cracking. And that's, to me, your nutrition. But I think at this point now, it would be great if, everything was organic and everybody was eating out of their own backyards, garden. But I think working on stress for everybody and then supporting our immune systems is incredibly important.
Yeah, that definitely dampens all those immune cells and immunity. When looking to de-stress, you said you use like the outdoors, exercise, you feed your body really well, you do your meditation. When working with our pets and your patients, what do you tell folks around that whole stress piece? Do you say, okay, you gotta, like you said, you gotta walk the talk, and then your animals will kind of resonate that level? Or is there other ways that kind of work well you've seen from like a compliance standpoint?
One of the easiest compliance things I think is, and this for owner and pet, is just go take them on a walk. Get outside and put your shoes on and just go on a walk. I mean, ultimately, walking is the best form of exercise because everybody can do it. It's a de-stressor for your dogs. They get to do their dog thing, and you get away from your phone, the TV, the noise, the stress. I think that's such a simple, I talk about meditation and I think it's wonderful, but so many people are kind of like, no, I can't sit still that long. So but walking is great for everybody. Put the kids in the stroller, put the dogs on the leash, and go walk. It's great exercise. It just clears your head. You're in a moving area, you listen to the birds. It's just a great habit to get into. That's a whole mind, body, energy reset.
Yeah, I couldn't have said it better. It's good medicine just to go for a nice walk, look at the sun, look at the plants, go with your pet. Yeah. So you use a lot of mushrooms, like you said, with cancer, support the immune system after surgery, anti-inflammatory effects. What sort of brought you into the whole medicinal mushroom world? What do you see in them other than obviously, this clinical effect? How did you come about them? Maybe you have a case study that you might want to talk about, anything to do with mushrooms and how you got there.
Years ago, actually, I read an article, and I can't remember where, about how Japan, they've done some studies on mushrooms and how all their oncology cases get mushrooms. And I was like, so I did some reading on the types of mushrooms, and I think it was probably 6 or 7 years ago that I read that. And there wasn't a lot of access to, I guess, mushrooms that I thought of here. So then I started looking into it, and I found a few products here and there. And there was an animal product that had mushrooms that they had different things for skin, for GI, for anxiety. And then I started learning about how they're processing the mushrooms and how the mushrooms are grown. And then I was like, that company, I was super thrilled because it was grown on oats, and I have a ton of animals with food allergies. So I'm like, this is really not going to be helping food allergy animals. So the more research I did and the more companies that came out and did help me with education, the better I'm informed. And there's mushrooms they use in Chinese herbs too, so especially cordyceps. So I really was like, well, and then I learned about turkey tail and cancer. So I specifically started going, okay, looking at them individually, the maitake shiitake mushrooms in cancer, and how reishi is just the immune modulator, which is very interesting because it's hard for, I think, in the conventional mindset to say if something supports the immune system, it's going to make it overreact or something. And I'm like, no, immune modulation is if it's overreacting, you balance it back down. And if it's underreacting, you bring it back up, you stimulate it. And how reishi mushrooms do that. So it's been kind of a very slow learning process for me. And honestly, I mean, I've been in AHVMA for many years, and I'm not even sure I've actually even been to a lecture about mushrooms. So it's been kind of a self-learning process. But I have found some really good companies, like your company, who's been very educational, and your products, even though we use your human products for our pets, they're very easy to use. And I'm a little bit obsessed with your chocolate, just to say that chocolate's really good. But yeah, it's been just kind of a self-learning adventure for me, and then teaching my other staff, the other doctors that I work with, and we carry the products that we carry in the powder form and the capsule form. We try to just use them as much as possible. It's interesting because with the supplement world, and I'm sure you know this, I've also worked with some CBD companies, is just how things are made makes all the difference, because there's so much, the market just gets flooded with any kind of product right off, someone's backyard, barn, whatever. So you got to be really careful about that. And so many people will be like, I've tried it, but it doesn't work. And more than likely it's the product. It's a very poor product. So that's really important to me too, is having a really good, well-studied, well-certified, reputable product.
Yeah, the context around quality is huge.
Yeah.
Yeah, big time. Okay. Well, this has been really nice. I really appreciate you taking the time to chat with us and share your knowledge. Coming from you, you're very, heart-centered, successful, busy, I'm sure, practitioner. Do you have any words of wisdom for someone that's just starting out, like either a holistic vet or some conventional vet that might be kind of, curious? Is there any I guess things that you use to kind of stay balanced between work and life?
Curious is the word. I mean, curiosity is just stay open to curiosity. My clinic does hours for veterinarians that have gone through the acupuncture course. So they come to me for a week for their 40 hours. And a lot of them are working in a conventional practice, and they're like, I have no idea how to, discuss this with my clients, much less the staff. So, and I'm like, just stay curious. And I kind of give them some basic stuff to start with. And students are always asking me questions, which I think is great. There's a whole group of new students coming out that are so interested in being more holistic practitioners. But yeah, I mean, if something looks interesting, it is frustrating that it's very so academic. Medicine is so academic. It's not. It's an art. And in being curious about it, you need to get out of the box and just kind of start looking around. So many people are like, there's no research on acupuncture. There's no research on this. I'm like, there is tons. Just because it's not in your one journal that you read once a month doesn't mean there's not tons of research out there. So I just tell people if you're interested in something, and when a client comes up and says, I've tried this and it worked great, don't blow it off. I mean, definitely go like, that's, interesting. I want to learn more about it, and just take the initiative and learn more about whatever this modality or supplement or treatment or whatever a client mentions or another colleague mentions. Just stay open, because I think conventional medicine it's getting very stagnant in some places, mindset. So be curious and have fun.
All right. Stay curious, have fun, keep that mind open to keep the flow going. Awesome.
Yeah.
Well, thanks so much, Colleen.
You're welcome.
And
thank you, Mason.
Yeah, you're welcome. And we will show all the notes that we talked about in the show notes for everything. And do you have a website? Do you have anywhere where people can kind of just learn more about your work, if they're local or if they just want to check you out? Do you have a website?
Yeah, the clinic is ChattanoogaHolisticVet.com.
Great. Okay.
Very simple.
Yeah, we'll link that in too.
Great. Thank you so much. That was fun talking.